Welcome, everyone. Thanks so much for joining us this afternoon. And we will get started in just about 30 seconds here. Let folks trickle in.
All right, I'm trying to advance here. Not advancing. Sarah, I'm not advancing. Oh, there we go. All right, well, hi, everyone. Welcome again to our session on civic literacy, media literacy, and health equity. I'm Janet, and I'll get us started, and then I'll turn this over to Sarah. So let me get my next slide going here. So, civic literacy, health equity, all of these words, but this is Health Literacy Month. We're right in the middle of it. So what about health literacy? What's the connection here? I'm advancing. Let me explain. So health literacy is essentially about your ability to figure out what's needed for you and others to stay alive and as well as possible. It's a very, very simplified definition of health literacy. Now, over the years, there have been many, many good definitions of health literacy that have been offered. This is a list of 17, and this is only as of 2009. There have been more since then, okay? But in 2005, there was one very, very interesting definition that has always stood out, at least with me. I think it has special meaning for public health crises. So as we talk about this particular definition, we'll explore it in depth, a little bit more depth anyway. Think about it in terms of this pandemic, in the context of this current pandemic. And this is their model of health literacy. In 2005, Chris Sarkadoulis, Andrew Pleasant, and David Greer gave us a really good article entitled Understanding Health Literacy, an Expanded Model. I highly recommend that if you haven't read this, you find it and read it, okay? And here's what they said, just in a few words. This is their definition of health literacy. They said, we define health literacy as the wide range of skills and competencies that people develop to seek out, comprehend, evaluate, and use health information and concepts to make informed choices, reduce health risks, and increase the quality of life. We're basically all trying to stay alive, at least most of us are, and as well as possible. Okay. But then they go on to say something even more interesting. Here's what they said. In our view, a health literate person is able to use health concepts. The pictures are hiding part of my slide. That's why I have to read it. Are to use health concepts and information generatively, meaning that people are able to apply information to novel situations. A health literate person, and listen to this, is able to participate in the ongoing public and private dialogues about health, medicine, scientific knowledge, and cultural beliefs. When have we had more discussion about, both privately and publicly, about health, medicine, scientific knowledge, and cultural beliefs than we have in this current pandemic over the past year and a half at this point? So their model suggests that becoming functionally health literate, it's really an expanded model, actually requires some key abilities in 4 central domains. Additional kinds of literacy in example is here. Let me just read these to you. So fundamental literacy, this is where we've focused a lot of our attention over the past, say, 20 years or so. People's ability to read, write, compute, and so forth. And we were right to and continue to focus on, the readability of our messages. We don't want to confuse people. We don't want to offend people. But they went beyond that. They talked about science literacy. They talked about cultural literacy, And then they talked about civic literacy. And we could spend time on any of these: science literacy, cultural literacy. We're in a big uproar right now about science and culture wars, scientists being even attacked. But today, we're going to focus a bit on civic literacy, especially with respect to this pandemic. Let's talk a little bit about this. Next slide. So what do they mean by civic literacy? According to their expanded model, civic literacy refers to the abilities that enable citizens to become aware of public issues, and to become involved in the decision-making process. And they listed 3 requirements to achieve some degree of civic literacy. And here they are. First of all, an awareness that individual health decisions can impact public health. This is their words back in 2005. This has always been an issue, but it's a real big issue right now. For example, should I wear a face mask to protect other people or not? Well, some people say, yeah, sure, I should. And other people say, no, absolutely not. Okay. Individual health decisions. Secondly, a knowledge of civic and governmental processes. Now, this is a big topic and complex because we have a very complicated government here in the United States of America. But here's a simple question. Which elected officials will help the greatest number of people to stay alive and well? It's an important question if you're trying to stay alive and well. If you're going to be voting, you have to ask that question. Okay. And then thirdly, some level of media literacy. Again, these were their words. For example, should I get my information about how to stay alive and well from this source of information or from that source of information? I suggested at this point in our pandemic, and in fact, since the very beginning, this is actually without being too dramatic, an issue of life and death. Next slide. Here's another one, media literacy. Is this COVID pandemic fake or real? Do vaccines cause more help or more harm? And where can I get information that I can trust? This is a huge issue. Okay. So in their model of health literacy, their expanded model, that goes way beyond just reading and writing and how clear our messages are and how effective our messages are. Some degree of health literacy involves some degree of civic literacy. And having some degree of civic literacy involves some degree of media literacy. So let's focus on media literacy and how it can help to promote health and health equity. And to do that, I will turn this over to Sarah. Sarah?
Thank you, Janet, so much. I am Sarah McGrew. I am an assistant professor at University of Maryland's College of Education. And very happy to be with all of you this afternoon. And I just want to add a quick housekeeping note that if you do have questions during our presentation, please feel free to enter them into the question and answer box, and Janet and I will have planned to leave plenty of time at the end of our presentation to take questions and hopefully answer some questions from you. Before we jump into media literacy, I want to zoom out just a little bit and introduce you to sort of 2 major approaches to countering mis and disinformation. So when we think about media literacy, a lot of our focus is on how do we make sure people aren't believing mis and disinformation, right? And I'll use misinformation mostly today for simplicity's sake, instead of saying mis and disinformation, but I'm really talking about both together, both unintentionally spread misinformation and more intentionally spread disinformation. So these 2 approaches are categorized mostly based on when they happen with respect to when people encounter misinformation. So before people encounter misinformation, we can make them more resilient to that misinformation. We can build their ability to decide what's true and what's not true before they encounter it. And we can do that through something called inoculation, which I'll discuss in just a moment, and through media literacy efforts. So most of my research and where we'll spend our time today is on media literacy, but I do want to quickly expose you to these other options. And then during or after an encounter with misinformation, we can debunk or correct that misinformation even after people have been exposed. So we're going to jump right into those strategies that can make people more resilient to misinformation before they encounter it, and talk first about inoculation. So borrowing from inoculation in a public health context, inoculation in this sense focuses on explaining misleading or manipulative argumentation strategies to people, essentially giving them weakened doses of those strategies, just like we would in many vaccinations, before they encounter misinformation, to help them build what researchers think of as cognitive antibodies, right? The ability to recognize when misinformation strategies are being used, and then hopefully think through and not fall victim to those strategies. And research suggests that there are two steps to an effective inoculation. The first is to warn of an impending threat of misinformation. So for example, some people try to cast doubt on the safety and efficacy of approved COVID-19 vaccines. And next, to refute the anticipated argument or evidence, and to be as specific as possible about the technique that's likely to be used and why it's problematic. So one technique they use is to mischaracterize the evidence base affirming the safety and effectiveness of COVID-19 vaccines, and instead claim that there's insufficient evidence or lack of expert consensus about the safety of the vaccines. So this example uses a specific claim about the safety and efficacy of the COVID vaccines, but there's evidence that more general inoculation can work too, that just teaching people about the general strategies that mis and disinformation users rely on, things like impersonating experts, using polarizing language, discrediting opponents, that those things can help people build up their defenses and make them less likely to be vulnerable to misinformation in the future. So the next piece where we're gonna, again, spend a lot of our time today is on media literacy education. And this is a really critical way to build resiliency across the whole population to misinformation. And as more people rely on the internet as their primary source for information, I focus on how people search for and evaluate information online. So media literacy can include being able to evaluate and find information offline and online, but we're going to talk today especially about online information. And the first thing I want to highlight is that the need for this is really, really real across the population. I've done extensive research on how middle school, high school, and college students evaluate online information, and found that really across the board, there are massive struggles that young people have to effectively evaluate online information. So they do things like jumping to evaluate content instead of considering where information was coming from and whether that source is reliable. Or they're often taken in by evidence that seems really persuasive. So things like videos or photographs or charts and infographics. So those are ways that young people need more support learning how to evaluate online information. But it's also not just young people. So we also have research, for example, that shows that older Americans, 60 and up, were the most likely to share fake news on Facebook. So this is a problem that really spans generations. There's a lot of myths out there about digital natives and digital immigrants, right? Folks that grew up or didn't grow up with technology. But a lot of that breaks down when we think about actually how people do at evaluating online information. And most of us just aren't very good. And that, of course, leaves us vulnerable to misinformation and ultimately can weaken the quality of the decisions that we make. Of course, it goes without saying, something that can have disastrous public health consequences. And then the second piece I want to highlight is that currently media literacy learning opportunities and outcomes are not equitably distributed. So there are struggles across the board, but in the US, high quality media literacy education and evidence of learning are often divided along lines of race and class in ways that, again, because the consequences of not having these abilities are really real, can have dire consequences. So how should we help people build their media literacy skills? And I have a two-part answer to this question that I think we can think about both in using informal context, right, but also informal context as you work with patients and communities, that these are two approaches to take when we're tackling media literacy. So what are these strong approaches? The first is to teach stronger approaches, right? And we're at Stanford, Sam Weinberg and I designed a study to compare 3 groups of participants that we thought might be really good at evaluating online information. So we compared groups of university-based historians, so people that have PhDs and study historical sources for a living, a group of freshmen at Stanford, so young, bright college students who got into one of the most selective universities in the country, and then a group of professional fact checkers, so folks who work at professional news and fact-checking organizations in the US. We sat them down in front of computers and asked them to think aloud as they evaluated and completed different tasks that asked them to both evaluate discrete websites and do some open searches for information. And I'll tell you a little bit about the strategies that they used in a moment, but first I want to introduce this framework of questions that we found fact checkers consistently asking when they tried to look for and evaluate online information. And the first question is just who's behind this information? And this is the most important question that I want to highlight, one that seems obvious when we think about it, but one that most of us actually kind of skip over. And that's who's behind this information, right? Where is this information coming from? Is this person an expert in this area? Should I trust them? What's their motivation to be providing the information? So really critical question that we should always be asking and trying to find reliable sources. Once we find sources that we trust, we can ask what's the evidence, right? We should consider whether there's actually evidence presented, what source provided that evidence, and whether the evidence actually supports the claims being made. And then finally, another really critical question to ask online is what do other sources say, right? So one of the strengths of the internet is that there's just more information than we could ever read in a lifetime, right? So if we're not sure about a source or a claim, we should turn to other sources and check what additional sources say, not just stay with the one that we originally found. So fact checkers, and we're going to zoom in on this a little bit, had a very specific strategy they used to investigate that question of who's behind this information. So what's this source and do I trust it? So I'm going to show you that strategy in action in just a moment with one of the fact checkers evaluating this website from the American College of Pediatricians. So this is an article we asked them to evaluate on bullying at school. And it was posted on this website of the American College of Pediatricians. So for those of you who don't know this organization, American College of Pediatricians is a small splinter organization of less than 500 members that has been labeled an anti-LGBT hate group by the Southern Poverty Law Center and condemned by the director of the NIH for using his research in ways that cause unnecessary anguish and encourage prejudice. So we asked them to evaluate this site along with an article also on bullying that was posted on the American Academy of Pediatrics, so the main professional organization of pediatricians, over 64,000 members, publishes pediatrics. So they were asked to compare these two websites and decide which one was more reliable. So I'm going to show you a fact checker in his first minute on the site of the American College of Pediatricians. So just think about what he does, and then after we watch him, we'll look at a student.
Okay, so the American College of Pediatricians. I think the first thing I would do is just see if I could find anything on the organization, of pediatricians. Even something basic like Wikipedia, which is obviously flawed. The American College of Pediatricians is a socially conservative association of pediatricians and other healthcare professionals in the United States. So that's interesting, right? The college was founded in 2002 by a group of pediatricians, including Joseph Zanga, a past president of the American, as a protest against the American Academy of Pediatrics support for adoption by gay couples. So, and that's the kind of thing that I never would have known if I had just looked at this. And yeah. So now I'm just reading the abstract. Schools should encourage an environment of respect. No one should be right. So this is interesting, right? Like the idea that no one should be harassed, but also no group should be singled out for special treatment. I feel like that's often code for, whatever kids who are more likely to be bullied, students of color or gay children, queer children or whatever, shouldn't be especially protected.
Okay. So this fact checker, landing on a site that he's never seen before, an organization that he doesn't know, invests no time in reading the original site, right? Instead, he immediately leaves the site and does what we have come to call lateral reading, right? Which is what it sounds like, opening new tabs on that lateral or horizontal axis of your browser and using a search engine and going to other sites to learn more about that original site. So lateral reading is a strategy designed for one of the web strengths, the fact that there's tons of interconnected information. And in this environment, it makes sense to learn more about, to rely on the resources of other websites to learn about one, right? And the fact checker in this case goes to Wikipedia. And this is something that we saw routinely with fact checkers actually, which is interesting because at least in school contexts, we often tell students not to ever trust Wikipedia. But we learned actually that it can be a really powerful starting point and a really common resource to use when we're trying to learn more about sources. So the fact checker learned quickly what the American College of Pediatricians was, and then returned to the original article with sort of, a new lens on who they were that allowed him to read and interpret the site differently than he might have if he had just stayed on the site. So I want you to hold what that fact checker did in your mind now, and we're going to turn to looking at a Stanford student. So this student had the exact same directions as the fact checker, and this is her first minute or so on the site.
Okay, so the American College of Pediatrics. Okay, this looks very official and very, I guess, medical in a way. Bullying at school. So to be honest, if I was looking up for something about bullying and I saw like a type of, I don't know, it seems weird to think of bullying as like a concept that's like covered by like medical people. So like, I don't know, I guess in my head, before even reading the article, I'm automatically thinking it's going to be something about like psychological effects or like psychological causes and stuff like that. And it has references at the end. So it seems to me, so it seems to be just a super like objective study of bullying. If I came across this as I was looking for information about bullying, it really depends what I'm looking for. I'm not really sure what one would do with this information. It's just effects of bullying punch. I guess this is very good information to have. I don't know, the information does seem very, very official, very legitimate, and it seems, I can almost assume that it was like peer reviewed because it looks so official.
Okay, so the student has a very different approach than the fact checker. The student never leaves the website, right? As opposed to the fact checker's lateral reading, the student does what we would call vertical reading, right? So reads this website like you would read a traditional print text, starts at the bottom and reads to the bottom and takes in clues from the page, right? Trusts herself to be able to evaluate this source based on her own background knowledge and on clues that the site is giving off, right, from its logo and its list of references and the information it provides. So she's trusting herself, but in this case, she comes to a very different conclusion, right? She decides that this is likely a trustworthy source about bullying. And she does that having not learned anything about the source itself, about what American College of Pediatricians is and what they stand for. And this was a trend that we saw across our participants. So after participants evaluated the site that I just showed you, along with that article on bullying from the American Academy of Pediatrics. So the American Academy of Pediatrics is in red there, and then the American College, the fringe organization with small, less than 500 members, is in yellow. And as you can see here, all of the fact checkers decided rightfully, I think, that the American Academy of Pediatrics, the main professional organization, was likely more reliable. And only about half of the historians definitively decided that the American Academy of Pediatrics was more reliable. Half of them either thought the American College of Pediatricians was more reliable or equivocated, said, I'm not sure, like they both seem to be okay. I'd have to do more digging. And only 20% of the Stanford students decided the American Academy of Pediatrics was more reliable. In contrast, like that student that we just watched, 64% decided that the American College of Pediatricians, this organization with fewer than 500 members and a very clear social agenda, was more reliable. So my goal in drawing this contrast is not to make fun of the historians or the Stanford students or to call them stupid. I don't think they are by any means. But these are all really talented people, smart people who have spent a lot of time in school, spent a lot of time online, and still haven't learned these strategies. This isn't just something that we pick up with enough school, with enough general thinking or general training in critical thinking, or because we're online all the time, right? These skills have to be explicitly taught. So just a few more comparisons that we saw between this rough group of what I would consider smart people, right? The historians and the students versus the fact checkers. So we already talked about how the students and the historians tended to read vertically. They treated the web like it was a static site, right? And sort of ignored the fact that there's so many other resources available if we just leave sites and engage like the fact checkers did in reading laterally. The historians and the students, again, engaged in really close, careful reading. They trusted themselves to be able to decide if something was true or not, which can be really dangerous, especially in territory where we're not experts on a topic, right? In most areas, I am not expert enough to read something carefully and decide how much to trust it, right? Instead, I need to find sources that I trust and trust them to provide me with information. So fact checkers did what we call strategic ignoring, right? Like we saw the fact checker do when he quickly clicked away from the site that he didn't recognize, got out of there until he knew more about what the organization was, and then was willing to come back. So lateral reading postpones an investment of our attention until we're sure that a source is actually worthy of giving our attention over to it. And then we saw the historians and the students click randomly. So when they were doing things like searching, typing in words into search engines, they would just sort of quickly click on the first or second result without thinking much about what they were clicking on. And that's a finding that has been replicated in lots of studies with people of different ages. Whereas the fact checkers engaged in what we called click restraint, or actually like scrolled down the full page of search results, looking again for sources they trusted to be reliable before they clicked anywhere. So let's consider, we're going to continue to focus on lateral reading and consider what it could look like in practice. So here's a social media post about a very current controversy of ivermectin. And we can see this tweet from Simone Gold, who, if you didn't recognize off the bat, right, you could get distracted by her claims, by the screenshots and evidence that she posts, right, and get sort of like taken in by the post itself. If we instead read laterally, right, we'd simply search for information about Simone Gold outside her Twitter feed itself. And you can see from what gets pulled up, right, there's several articles that provide information about her, as well as a Wikipedia page that would provide more. And I want to point out one real strength of lateral reading is that this preserves people's decision-making abilities, right? In this case, I'm not telling students or adults this person is or is not a reliable source, right? I'm giving them skills that they need to do some of that digging for themselves and then make hopefully a more informed decision, right? So in this case, if a participant or person still decided that once they knew more about Simone Gold, they still trusted her as a source, that would potentially be okay, right? That's very different than just trusting Simone Gold because she seems to, make strong claims or post a lot of evidence. So the second piece, in addition to teaching strong approaches to evaluating information, is that we need to explicitly address flawed approaches. So the internet, even though it hasn't been around a very long time, has changed so quickly that a lot of the tools or assumptions that we make about how to evaluate online information are just wrong. Maybe they used to be true and they're not true anymore, or they were never true and we continue to use them. So just two examples here, and there's several more of these. People make a lot of assumptions about URLs, and especially about the top level domain, the .org or .com or .edu that ends a web address. So many people think that .org domains are more reliable because they can only be used by nonprofits, and therefore that .com websites are less trustworthy. And that is in fact just not true anymore. It used to be true that you had to be a nonprofit to register for a .org. It's not true anymore. Anybody can get a .org. So there's no difference between .org and .coms, and yet that continues to be a really strong decision-making tool that a lot of people use when they're trying to decide if something is reliable. And then there's also a lot of misconceptions that have developed about social media. So people assume, for example, that verified accounts are always more trustworthy, when in fact verified just means that the person is who they claim to be, not that the social media company has decided that they're definitely reliable. We also know from studies with a lot of adults that people assume that accounts with more followers, more likes, more shares are more credible. And again, can think of lots of examples of when that's not the case, right? The number of followers, likes, shares, and views has no relationship to credibility. So there's several, again, things like this that are currently flawed approaches that we know how to do better. And we need to just explicitly help people tackle some of these misconceptions and correct them. And I just want to emphasize again that this isn't just students. So I've found librarians, for example, lots of librarians who still believe that .org websites are more reliable than .com, and lots of adults who have those misconceptions about social media. And using those flawed approaches, again, instead, especially of something like lateral reading, can quickly mislead us. So again, if we go back to Simone Gold's Twitter account, we see that she posts a website that ends in .org, right, which automatically makes a lot of people assume it's more reliable. She has over 300,000 followers. Her individual tweets get a lot of engagement, lots of retweets, lots of likes. So those could make someone think that she's quite credible, right? And so they might come to a different conclusion from that than from reading laterally and learning more about who Simone Gold is and what she's advocated for in the past. So those features, it's really important to emphasize, are just not related to reliability, even though lots of people continue to believe that they are. So the good news is that teaching stronger approaches, and addressing explicitly misconceptions about how to evaluate online information works. So I've done several studies in the last few years with high school and college students. And teaching those stronger approaches, explicitly addressing misconceptions, results in students being better at evaluating online information. So this graphic is from a study where high school government teachers taught just 6 lessons on evaluation strategies like lateral reading. So the white bar there that's labeled core classrooms taught civic online reasoning, which is these strategies like lateral reading and asking who's behind this information, compared to the blue bar, which was a control, just regular government classrooms that weren't teaching media literacy explicitly. And you can see there that there's a significant growth, in a little bit in both classrooms, but significantly in the classroom where students were explicitly learning to evaluate online information. And then just one more study, this from a college class that colleagues of mine did. So this was an intervention to teach college students in a nutrition course to read laterally. And students evaluated a website before and after the intervention. So this is a graph showing the difference in the approaches those students took on the pretest before any of the lessons, and then on the post-test after them. So you can see on the pretest, a lot of students are using strategies like judging the website based on its .org domain, on its appearance, on how it describes itself on its about page, or the amount of information it provides. And then on the post-test, those students using those strategies drastically decreases, and the amount of students who read laterally increases, several fold. Over 60% are using lateral reading on the post-test. So what this looks like, I think, we have evidence that this works, and it works in formal educational environments. Now, what it looks like with adults who are not in school is, of course, an open question and a trickier question because they're not as willing an audience as students in school are. But there are examples of workshops in libraries, in community centers, and of course, in one-to-one educational efforts for our families, our friends, our patients, our fellow community members that I think can do a lot of good in terms of teaching stronger approaches and countering some of those misconceptions that people continue to have about how to evaluate online information. So we've spent a lot of time talking about making people more resilient through media literacy. I want to quickly address before we wrap up what to do once misinformation is out there, right? If it's out there in the world, so while people are encountering it or after they've encountered it. And there's quite a bit of research about debunking information, right? And what it looks like to effectively address misinformation after people have been exposed, which despite our best efforts at media literacy is likely to need to happen. So to be effective, debunking ideally follows this formula, which is described very clearly in the Debunking Handbook 2020, which was written by 22 prominent misinformation scholars and summarizes our current consensus on the science of debunking. So when we debunk, it's important to lead with a fact. Think about this like a fact sandwich, where we lead with a fact and keep it clear, pithy, and sticky, right? Something that's concrete and plausible to the listener. We then warn about the misinformation or the myth that's coming and say that misinformation or that myth only once, right? We don't want to repeat the myth over and over because we know that being exposed to something, even if it's untrue over and over and over, does make us more likely to believe that it's true. You then want to explain how the myth misleads, what's wrong about it, and finish by reinforcing the fact, restating what you started with, if necessary, multiple times. And it's really important that factual alternative is ideally just as simply stated as the myth or the misinformation to begin with, right? That there's a one-to-one replacement about you might think this or you might have heard this, but in fact this. And your factual explanation is not more complicated than the original, so it can be replaced. It is important before you debunk to ask yourself a few questions and to adjust your strategy depending on your answers, right? So the first is the story circulating widely? And if it's not, then it might be better left alone, right? Because again, we don't want to emphasize misinformation or myths by putting them out in the world too much if they're not already circulating widely. The second question would be, is the framing of the misinformation fluid, right? So if there's a very clear story, then debunking works well. If it's fluid and there's not really one clear rumor or myth, it might be better to just stick with the positive talking points with stating what the facts are, than instead of trying to debunk it. And then finally, and I think most importantly, are you trusted by the target group, right? Are people likely to listen to you and trust you as you debunk it? And if you're not, then it might be better to leave the debunking to somebody who is trusted by that group. So I want to wrap up and start to move towards your questions. So please do be putting questions or comments in the Q&A. But I want to be honest with you about what we still don't know about, especially how to teach people to evaluate information. And especially because we did based a lot of this work on how professional fact checkers evaluate information. And professional fact checkers are at their job. They're evaluating information that was given to them, not presented to them by family, friends, personal acquaintances, and not necessarily that they have strong feelings or emotions about. So there's still a lot to know about how things like our identities, our beliefs, our motivations influence how well we can learn to evaluate information, what we're using the information for, who shared it, and how much you trust them. That all of these things make the online information ecosystem really complex. And we have a lot more work to do to understand how these factors influence us and the information we trust, but also how to help people be more oriented towards finding accurate information when they're online and doing the evaluations necessary to decide whether information is worth trusting in the first place. So while I will say that we absolutely have a good sense of the approaches and strategies to teach, there's still definitely work to do here. And with that, I want to move into a question and answer period. So there's a couple questions in the chat, it looks like, or in the Q&A, but please do feel free to enter more questions as we go. We'll try to address them. So there's a question about inoculation. The inoculation theory is like an injection under the skin for people to be immune from these bad influences of any misleading information. My question is how local organizations work alone to immune our whole society. I understand that every agency is doing its part regarding face-to-face literacy or outreaching as much as we can. And yeah, I think, and Janet, I'd love to hear what you think on this question too, on how local organizations, together can make a big impact. But I think that especially because we know that people are more likely to take up inoculations or debunking or media literacy education from people that they trust, right? That it's really important for local organizations who have a lot of trust in communities to be doing that work, right? That like big national organizations coming in and trying to do that might just not be as effective on the ground. So even though it is a piecemeal approach, I think that local approach is really important, especially when we're talking about these issues of trust, and that's so localized. Janet, do you have anything you want to add there?
Yeah, I think that local agencies need to know what you just said, and maybe they don't. I wouldn't be surprised if they don't. They are probably trying very, very hard to deal with this issue of misinformation, and they would benefit from this. How to get this information to them, to these many local agencies, I don't know, but I think that this is information, if put in good plain clear language, that they may benefit from, so that when they're doing their messaging or when they're interacting with the people they are they're working on, whose behalf they are working, they'll be able to be even more effective. I'm sure many people, and then they're individuals, I think many people are frustrated. They have people in their families who are saying things that you're thinking, well, no, that's not it. What do you do to help your children, your grandchildren, your loved ones understand all of what you just said? These are really good guidelines. I think they need to be generalized.
Yeah, and this next question I think is very related to that. How can you teach the public or community who are not academics or in school these fact checkers evaluation strategies? And I think, again, that goes to how do we access people that aren't in school anymore, right? And I started to say, there's, I think there are resources in our communities, right, including our health professionals, right, that in one-on-one settings or smaller workshop settings could start to teach these. I think public libraries are an incredible resource that already do some of this work, but I think could continue to again, public libraries incredibly trusted in communities, as trust in everything has declined practically in our society. Trust in libraries has remained pretty stable. So I think that's another resource. And then there's larger scale efforts, right? Like I worked when I was at Stanford with Crash Course, which is a popular YouTube series that John and Hank Green run, one of the original sort of viral YouTube channels. And we built a 10-part, 10-episode series on how to evaluate online information. So they're each, 10 to 15 minutes long. So they're not short, but it goes through those 3 questions I introduced of who's behind the information, what's the evidence, and what do other sources say, and gives examples and walks people through how to evaluate information. So again, if people are willing, there's resources out there. But I think it does take sort of a large scale community effort to make sure they have access to them. Would you add anything to that, Janet?
Not really. I think everybody's asking the same kind of question, is, how do we get this information out to people who are struggling with this issue? I think if we can codify it in some way, make it easy to read, easy to understand, easy to follow, and find ways to disseminate this, I think that would be it would be very helpful. And for any of us who are, any of us who are listening, I think we can take this, because we are a network here. This is, all of us who are attending this conference and similar conferences. I think these are the kinds of things that we're all dealing with. I think we should be able to take this and through our own networks, disseminate this information. make it very simple and easy to use. The real question for me is when people have dug in, they have really, dug in their heels. At this point, and particularly in this pandemic, people have separated into essentially almost something like tribes. I don't know how to deal with that. Some people are in search of the information that will support what they want to promote, and how to deal with that is beyond me. I hope you have some insight on that.
Yeah, and I mean, I have some insight. I want to be honest that that issue is huge. It goes well beyond just the issue of encountering online mis and disinformation, right? The increasing polarization and hyperpartisanship in the US, and the fact that even things like vaccines have gotten partisan or politicized is a huge issue. But I do agree that that's an issue and that is top of mind for so many of us. But I think in focusing on that, we forget that there are just people who don't know how to go about evaluating information and may think that they have good information when they in fact don't, or have some of those misconceptions about how to evaluate information that I just shared. So again, because most people are so busy just going about their lives and trying to survive, right? They might have heard things along the way and think they believe something, but when actually educated and taught some of these skills for evaluating information, might be able to make adjustments. Now, I certainly agree that there are hardcore partisans that will be very hard to move, but I retain faith from working, especially with younger people, that it's really possible to make a difference if we teach these evaluation strategies explicitly.
Mm-hmm. We have some new questions.
Yeah, and I see some in the chat too. So I'm just reading. So somebody asked, do you find it's necessary to start with non-controversial topics first to ensure people remain open to learning these skills? And I think you want to start with a topic that's simple enough that people can understand it and they can reason about. You want people to be able to think about how the source of information affects the content that they're seeing. So if it's a really complex issue that people can't understand, that would make it hard because you want to be able to focus on the skill. But in working with younger people, I use controversial issues to begin with, again, because I want those controversial issues to mirror the issues that students are seeing in their real lives outside the classroom or the situation that we're in. So I take on the hard stuff right away, and young people are more engaged by that often, right? But if you're worried about something really polarized, you could start with something simpler to begin with. I'm just looking through the other questions. So how do you provide this information for limited English patients? How can we take into account cultural and language differences in a clinical setting? That's a really important question, and one that I don't think I have a wonderful answer to, other than I think strategies like lateral reading can be taught and then used in a patient's native language or first language, and the actual strategies themselves can be taught more visually, I think, right? Like even the visual of lateral reading and telling people to make that move instead of staying on a website is really important. I would also point out, right, that by reading laterally, getting out of a site, we often actually end up needing to read less because we can eliminate bad sources quickly instead of investing our time in trying to read and understand a lot that might be really hard for people, especially English learners. So lateral reading is usually more efficient, actually, in addition to being more effective.
I'm seeing a couple of really good questions here.
You want to read them out, Janet, if you see them?
There's so much distrust in governmental organizations right now. How do you suggest we as health educators can help change that narrative? Concern is that people won't trust information that this is huge. Hospitals like the one I work for put out through references to these organizations. It comes up over and over again.
Yeah, it's a huge and really important question. And when in this health context, I think the question of what are those organizations that we can routinely turn to and why should we trust them is echoed in, conversations about social and political topics too, where it's like, why should we trust news organizations? So I think the first part of that is teaching some explicit content knowledge, right? What I would consider to be news literacy, but is also probably health literacy, right? Which is like, what do these organizations do? What processes do they have in place to try to make sure that they're putting out accurate information, to admit mistakes when they make them, ideally, right? What are the backgrounds of the people who run those organizations, and why should we trust them? And then also, I think, to admit the harm that some of those organizations have done to especially minoritized communities in the past, right? And I think we need to be transparent about that in order to build trust, especially in those minoritized communities. That there's certainly been lots of harm done, but that doesn't mean, ideally, right, that people should stop paying attention to the organizations. So I think that's a big part of it. Go ahead, Janet.
Yeah, I addressed this last year at a talk I gave to the Colorado Health Literacy Coalition meeting. I touched a little bit more in a little bit more detail on science literacy, and that if you're going to be promoting health literacy, you're really going to be, that means you're going to be promoting not only fundamental literacy, which is, again, we spent a lot of time doing, and we should continue to do so, but science literacy. Just a history of science. People have no idea, for example, who Fauci is. I mean, if anybody had any idea, people like Salk, all of these people, and the effect that vaccines have had on people, over the, past several decades. People are not aware of this. They're not taught this. They're taught the issue of uncertainty in science. This is something that needs to be taught. This is science literacy. Again, this is why it fits so nicely into that expanded model. Spending more time on science literacy, I think, would be really, really important, and not just for children, but for the adults who missed it when they were in school. So it's hard to talk about the Centers for Disease Control if you have no sense of how it fits into the bigger picture, what it means in our daily lives, things that we take for granted, the health that we take for granted, not to mention the technology that we take for granted, that is based completely on scientific information. So science literacy is something that I think has been overlooked. I was glad that that team in 2005 brought it up. If I do anything else, I'll spend more time on science literacy than probably anything else. I think it's missing. Yeah.
Yeah.
And then Cynthia asked a question about the crash course. Maybe do you have that information for her, Cynthia Bauer?
Yeah, I just put it in the chat too.
Oh, okay,
the crash course series is called Navigating Digital Information. So if you just search for a crash course Navigating Digital Information, it'll come up. John Green narrates it. The other thing I would just say to that question about distrust in organizations is that, I mean, I do think we want to be teaching explicitly about what those organizations are and why we should trust them. But I just want to highlight that other piece of lateral reading that I talked about, which is that if we're teaching a process for determining reliability, we're not always in the situation of having to be the person who says this is reliable and this isn't reliable, right? We're putting that on the patient or the user or the participant to decide for themselves once they have more information. So I think it's an empowering approach too, right? That is hopefully allowing them to build trust along the way.
And let me also repeat what you said a while ago, which is something that I said last year at that particular meeting, is that you have to be able to acknowledge the things, the times at which, scientists have gone sideways, and that happens. Mm-hmm. You have to be able to say that in order to, you can't ask for trust if you're not, if you don't shed some light on some of the things that have happened in science and frankly continue to happen. But then helping people figure out how to balance that, with the things that science has given us and science has done to make our lives a lot better. But you have to be able to expose both sides, or present both sides, I should say.
Yeah. Somebody asked about how generalizable are the Stanford student findings, and we haven't done massive studies on the scale, although our findings echoed, what other researchers have found with a range of populations. So in some ways, what the Stanford students did in our study just sort of confirmed a lot of other research that's been done for the last couple of decades about people's general approach to evaluating information, which is to, read online like we read in print and just kind of like dig in and do our best on our own to decide what to trust, which we learned from the fact checkers is just not a very efficient or effective approach.
Are there other questions?
There's one more, but go ahead, Janet.
No, let's deal with that one first.
I think somebody asked in the chat, you said get the word to people struggling with this concept. I think many people don't know they've gotten mis or disinformation, and how do we train to that? And I think that's true. And the people who are misinformed may be the least likely to admit that they are, right? So my approach is to assume that everybody needs help learning to evaluate information, and to help them recognize that. So I even, have done work with the University of Maryland undergraduates who, come to college thinking that they're good at evaluating online information. And, when confronted with some of those misconceptions, like, do you think that a .org is more reliable than a .com? Very quickly realize that they might actually need more help learning to evaluate information. So I think the strategy is don't just try to target one population, but assume that everybody needs more support in this area.
And the only thing that I would add is that we can use, particularly this health literacy community, use our hopefully the skills that I hope we each have, or at least many of us have, to communicate effectively. And that's just, I don't mean just clearly, but really effectively across the literacy levels, the range of them, not just for people who have, marginal literacy skills, but for people who are busy and who are overwhelmed with the barrage of information. Some people just don't have time to read long, articles about things. Some people do, but many people don't. So how we present this kind of information counts, whether it's about, the other aspects of civic literacy, if it's specifically about media literacy, if it has to do with what we want to communicate with people about science, or just the culture wars, that's a whole other issue in and of itself. We can do so hopefully in a way that it makes information easy to access, easy to scan, makes it scannable, easy to act upon, not just for the people who we think are really struggling out there, the so-called, hard to reach, but for everybody, because right now many people are hard to reach because life is just complex. So I think we have to communicate, we have to always think about this and, try to say, put things in sort of abstract form. Here's some basic things that, you need to know, here's why. Here's what you can do about it. And then if you want to read more, give them, a little bit more. But I think we need to be able to make this really crucial information available in ways that people can quickly digest and easily use.
Yeah, and I think it's a good point about having like layers of complexity. Like the first questions are just always ask who's buying this information and remember to read laterally. That's the big picture, really important headline that I use when teaching people. And then we can get more complex from there. But yeah, absolutely, starting with a really simple message.
So, one thing I want to leave everybody with is when we talk about health literacy, maybe it's just me. I feel that, we should, I believe this expanded model is very helpful. It has been helpful for me over the past, I don't know, what is 15, 16 years, ever since I read it. I've always used this as a way of looking at health literacy. How do you promote health literacy? Well, effective communication is one way of promoting health literacy. It's a fundamental, it's foundational for all of us. But there are other things that we need to do. We need to think about science literacy and how do we promote that to shore up our sense of health literacy. How do we promote civic literacy and all that involves so that we can do the kinds of things that we need to do to stay alive and as well as possible. So I invite people to, include this in their way of looking at promoting health literacy. Health literacy is the goal. It's not the process. That's the way I look at it. Health literacy means that you and I and everybody else, that we are able to do the kinds of things that we need to do to stay alive and as well as possible. The question is, what do we need to do in order to make people do that? Communicate effectively, promote science literacy, promote civic literacy, and also cultural literacy for all of us.
And I think that's the end of our session, everyone. So thank you so much for participating and asking questions and being here. Our contact information is there if you have additional questions or thoughts. But thank you again so much for being with us.
Thanks. Bye-bye.